Some revolutions don't begin in capitals or laboratories. They begin in a forgotten village, where babies were not expected to survive. In the 1980s, the remote tribal district of Gadchiroli in Maharashtra had one of the highest infant mortality rates in India. Hospitals were hours away. Most births happened at home without trained help, and newborns often died from infections that could have been prevented with something as simple as warmth, cleanliness, and basic antibiotics. For many families, losing a baby wasn't rare, it was normal. Into this world walked two young doctors, Dr. Abhay Bang and Dr. Rani Bang. Both highly trained, both with opportunities to build prestigious careers anywhere they wanted. Yet they made a radically different choice. They left the comfort of the city, moved into one of India's most underserved regions, and decided to stay for as long as the community needed them. People asked them why. Dr. Abhay Bang answered with a sentence that would define the rest of their lives. If health is a right, then the poorest deserve it first. What they saw in Gadchiroli stunned them. Mothers giving birth without medical help. Newborns dying from treatable infections. Women suffering silently from reproductive health problems. People walking miles for care that often came too late. It wasn't just a medical crisis. It was the complete absence of a system. So the Bangs did something no one expected. They created a new system from scratch. One built not around doctors or hospitals, but around the people themselves. They began training ordinary village women to become newborn care providers. Not nurses, not specialists, just women who already cared for their neighbors and were willing to learn. They taught them how to recognize infection, how to keep a baby warm, how to give simple treatments safely, and how to provide care in those critical first weeks of life. It was a bold idea and at the time almost unheard of. But it worked. In just a few years, infant deaths in Gadchiroli dropped by more than half. A result so dramatic that the world's leading medical journal, the Lancet, published their findings. The Bangs went on to publish 3 separate groundbreaking studies in the Lancet, a remarkable achievement that placed them among India's most influential medical researchers. Their model home-based newborn care didn't stay in the village where it was born. India adopted it, then other Asian countries, then regions across Africa. Today, HBNC is recommended by both WHO and UNICEF and is credited with helping save hundreds of thousands of newborn lives around the world. In 2005, Time magazine named Dr. Abhay and Dr. Rani Bang among its global health heroes. But the Bangs themselves always insisted that the true heroes were the village women, the local caregivers who became the first line of defense for newborns who otherwise would never reach a hospital. In 1986, the couple founded SEARCH, the Society for Education, Action and Research in Community Health, right in the middle of the forest. It became a place where science and community met, where tribal families received respectful care, and where medical solutions were built alongside the people who needed them most. The Bangs never pursued fame, wealth, or recognition. They stayed in Gadchiroli for decades, choosing a life of service over comfort, and proving that world-changing innovation can come from the most unlikely places. Their legacy is quiet but enormous. They showed the world that saving lives doesn't always require high technology or giant hospitals. Sometimes it begins with a newborn wrapped in a warm cloth, a trained village worker kneeling beside a mother, and 2 doctors who refused to walk away from those who needed them most. And because of that decision, made in a remote village many people still can't find on a map, countless children around the world are alive today.